UnitedHealth says that it is aiming to bring systems back online by today after a massive healthcare hack described as the most serious on the U.S. healthcare system to date. That disruption is in its fourth week. It brought payments and other systems offline and is estimated to be costing healthcare providers as much as $1 billion a day. For more on this, we want to bring in former FDA Commissioner Dr. Scott Gottlieb. He is a board member of Illumina and Pfizer, also a CNBC contributor. And Dr. Gottlieb, I don't think we've done enough to explain this situation and describe to people what's really happening. This is kind of catastrophic. What happened?
Yeah, it's very pervasive across the entire healthcare system. This is one of the largest facilitators of health claims and medical claims in the country. They handle about 15 billion claims a year, totaling around $1.5 trillion. So basically a third of the entire healthcare system. We have a $4.5 trillion healthcare system. And what this system does is it handles claims not just for UnitedHealthcare, but for other insurers as well. So doctors will subscribe to this system. They'll contract with it. And it will tell them whether or not patients are eligible to receive a prescription or whether they're eligible against their insurance plan to receive a certain procedure, what the cost will be, what the provider will be paid, what the copay to the patient will be. So if a patient comes into a provider right now or goes to a pharmacy and this system's down, they don't know whether or not their claim's going to get covered. The provider doesn't know whether or not they're going to get paid. The patient doesn't know what the out-of-pocket costs are going to be. So these are being adjudicated by hand in many cases. Some insurers have stepped in and said, look, if you make a good faith effort, we'll backstop the providers. United has done that, particularly on the claim side for prescription drugs. But other insurers haven't. And so you have the system right now, in many cases, in limbo. Some elective procedures are getting pushed off. Others just are getting done, but providers don't know when they'll get paid, and they're out of pocket for the revenue right now.
Are there surgeries that are life-threatening that aren't getting done as a result? Are there people who are going without necessary medications as a result of this?
Yeah, I haven't heard any anecdotes where things that are necessary aren't getting done. I suspect that there are elective things that are getting pushed off. I've heard stories where prescriptions are getting filled for 2 weeks at a time, so pharmacies aren't filling prescriptions for a month or 3 months at a time because they're uncertain whether or not they're going to get reimbursed, whether or not the patient's eligible to receive a medication, what the copay is going to be. So I think there's definitely some dislocation in the market right now. We're probably going to see that show up to some extent when we see quarterly earnings from some of these big provider systems. And I suspect we're going to see when United reports on April 12th their earnings, what the cost to United has been, because they've stepped in to backstop a lot of these claims. Some of them probably the patients weren't eligible for. And United's going to have to eat those costs. I know they've done quite a bit on the pharmacy side to backstop pharmacies, because a lot of these pharmacies are mom-and-pop pharmacies, about 20,000 pharmacies in this country, fully a third of all the dispensed medication, upwards maybe of a half, are from mom-and-pop pharmacies, not the big chains that don't have the ability to bridge themselves in an instance like this.
We think of this as being such a wide system, a healthcare system, but the idea that there's a point of redundancy that affects a third of all of that, was this a surprise to you?
Yeah, it was. And I think that we need to look outside the industries we've traditionally looked at, like financial services or transportation or infrastructure, where there's these single points of failure. There's other medical processing companies like Waystar that also process a lot of claims. And I think we never thought about these sort of single points of failure, these single nodes, in industries that were perceived as fragmented, so it was hard to take down. You perceive the medical industry as a fragmented industry, as lots of providers, lots of hospitals, and you never really thought about this single connected system. What happened here, this is a worm-like virus that has lateral movement within the system. So it didn't just infect this Change Healthcare system inside United's central servers, but it actually branched out into all the nodes that were connected to that. So literally every health system that's connected to this Change Healthcare system now needs to be checked to see whether or not this worm-like feature had lateral movement into those systems. That's why it's so hard to get this turned back on, because they need to check every node that's connected into the Change Healthcare infrastructure, if you will. This is the same virus that or same group that was believed to be behind the Colonial Pipeline ransomware attack in 2021, and also the ransomware attack against MGM and Caesars in 2023. So it's a known group, a known feature, if you will, a known attack. Just hasn't affected something like this in the healthcare industry before.
I mean, if they're able to identify a weakness in the system that you, as the former head of the FDA, didn't even recognize or see, I mean, that suggests an awful high level of sophistication. Is there the idea that this could be a potential nation state really targeting U.S. infrastructure?
Well, the group that's responsible for this isn't believed to be a national actor. This is a known ransomware gang. I think we need to look, I think CIS and other groups that look for the soft targets inside the U.S. economy need to now look differently through a different lens to see whether or not there's other very fragmented industry that you never thought had a single point of failure that has a soft target like this. CMS was also slow to recognize this, I believe. They didn't put out their first statement until March 5th, so we were alerted to this on February 28th. The attack happened on the 21st. We were first alerted from a statement that the American Hospital Association put out, I believe, on the 28th. CMS, the Centers for Medicare and Medicaid Services, didn't put out a statement until March 5th. So the government here looked like it was slow to act as well. I don't think early on there was a recognition of how pervasive this would be and what the impact would be across the healthcare landscape. We started to hear it. I started to hear it anecdotally from providers who were hooked into the system, the impact it was having on their offices. And you started to see things appear online from providers complaining about this. But I think that we were slow to recognize, or the government was slow to recognize what kind of impact this would have if it was protracted. And it should have been recognized that this was going to be protracted right from the outset.